everyone in?
Doesn't matter.
Good morning. Our next speaker is Dr. Louisa Williams. She's been a member of our organization since the very beginning. She's a chiropractor and a naturopath, and the author of the wonderful book, Radical Medicine. If you don't have it, please, you should have it in your repertoire of medical books. So let's welcome Dr. Louisa Williams.
Dave, oh no, it's okay. I thought I'd messed up. Okay, good morning. All right, so I don't know what the statistics are on how much is retained from these lectures. I think it's a scary statistic, like you take away 20% or 30% or whatever. I hope you take away 100% and have a really good understanding of what I'm trying to convey this morning. But regardless, I'm going to alert you. Dave, this is loud, no? Are you okay? Okay. I will alert you to some clinical pearls that I think are really important for all dental physicians, dental hygienists, holistic physicians, and practitioners to make note of that I've found out in my clinical experience. All right, so my subject today is autoimmune disease. Let's begin with just the definition of autoimmune disease. Basically, that's when the immune system can't differentiate between a normal human cell and a pathogenic microbial cell, right? It's saying, is this a bacteria? Is this a bacterial cell, or is this my cell? So the classic expression we use is the body can't recognize self from non-self, right? So with rheumatoid arthritis, for example, the immune system mistakenly attacks joint capsules, causes destruction of cartilage and tendons, and rather than the foreign microbe, often streptococcal bacteria from focal infections, it's attacking its own tissue. So then what do we try to do? What's the body primed to do in life? Survive. At any cost, we must survive. So in order to have functional wrists and hands to survive, the body then sends in calcium, excessive deposits of calcium, to make us have functional dexterity. And then we really lose our blueprint. Then the body gets into this whole adaptive distortion pattern. And it's very hard to turn this around. That's why autoimmune diseases are the most difficult to treat. All of the inflammatory bowel disease nowadays, quite epidemic. Crohn's disease, classically on the right in the ileum, but also throughout the colon. Ulcerative colitis, only on the primarily on the left, descending colon, sigmoid, rectum, causing chronic inflammation, abdominal pain, severe diarrhea, etc., and just a miserable life. Or diabetes type 1, same thing, autoimmune, right? A hypoproduction of insulin. We're just not getting enough insulin secreted because the immune system cells, again, are mistakenly attacking and killing the beta cells in the pancreas. So then the person becomes insulin dependent. So we all know this. We've just got so many autoimmune diseases nowadays. But what I like to do, being a good Weston A. Price member, as many of you guys are, is to take a historical perspective. You know, what did our former pioneers and what did ancient civilizations do when there wasn't a nice rest stop along the road and nice flush toilet? So at the Weston A. Price Foundation, and any time, history teaches us everything, right? We want to take an anthropological view. What was the deal in the 1800s, 1700s, 1600s? Well, the fact was, like so many things in this notorious 20th century, Autoimmune disease was exceptionally rare before the 20th century. Hashimoto thyroiditis, he identified 4 patients in 1912. Diabetes type 1 was rare. Diabetes type 2 wasn't even named yet. Crohn's first identified that irritable bowel tendency in 1932. So let's fast forward to the 21st century, where we are now, 100 years later, from negligible, small amounts, rare autoimmune disease, to now currently over 100 autoimmune diseases identified, 40 more suspected. It's an extremely rapid onset of a new category of disease, right? In 1 century, we go from 2 to over 100. And currently, autoimmune disease as a category is the most common category of disease. It's eclipsed heart disease, congenital heart failure, heart attack, stroke. It's eclipsed that. It's eclipsed cancer, all the types of cancer. And the last few decades, the end of the 20th century, beginning of the 21st century, it's tripled. So it's really speeding up. So, of course, any disease that has any category that has hundreds of diseases is an epidemic, but why am I calling it a hidden epidemic? Well, the fact is that these over 100 named autoimmune diseases are just the tip of the iceberg. Broadly speaking, most chronic symptoms that do not respond to our treatment are autoimmune. The body has lost its blueprint. It's confused, it's in chaos, it's not functioning due to normal regulation, normal homeostasis. In actuality, there are multitudes of symptoms that fall into this category. So we ask ourselves, why are there so many autoimmune diseases nowadays? What also occurred during the 20th century? Well, I don't need to ask this group what also occurred, right? Heavy metals. After World War II especially, dentists came home. They were trained to place mercury amalgam fillings. It was easy. It was inexpensive, right? We had a whole army, literally, of dentists doing that. It became the norm. Toxic chemicals. The 20th century is the chemical age, right? Better living through chemistry. Insecticides, pesticides, herbicides. More than 2,000 new chemicals at one point were being produced every year, with very little oversight from the EPA, the FDA, the CDC. Toxic vaccines. How many vaccines does a well-vaccinated child get now from birth to 18? 69. 69 vaccines. Because when you hit your freshman year in college, you got to get more vaccines, right? My mother was born in 1915. She had 1 vaccine in her whole life, smallpox. 1 vaccine, the turn of the 20th century, to 69, the turn of the 21st century right now. She lived till 95, was in great shape, would have lived longer and healthily if she didn't succumb to allopathic intervention. But the question is, of these 3 outrageous insults of the 20th century, what's a 4th one? What's a 4th one? Allopathic drugs, and specifically antibiotics, the miracle drug, right? So to his credit, Sir Alexander Fleming, the discoverer of the first antibiotic, penicillin, back in 1928, said the misuse of penicillin could lead to the selection and propagation of mutant forms of bacteria resistant to the drug. Isn't that amazing? The very beginning, he warned against the very drug that gave him the title Sir and made him famous. So has anybody here not taken antibiotics? Yeah, we've all had antibiotics, right? So what do these antibiotics do in our system? Well, they cause resistance, and that's not just a nosocomial hospital phenomenon. Yes, there are patients dying from MRSA and MRSA and all kinds of resistance in hospitals, but when we take antibiotics for certain conditions, outpatient-wise, we don't come away unscathed. So what happens when we take antibiotics? We kill the weaker bacteria, often with some symptom relief,
But the stronger bacteria remain. They learn how to survive, and they become resistant in our bodies. Who knows Lyda Matman? A lot of us, yeah, and got to see her lecture before her death in 2008. Famous virologist and immunologist. In over 3 decades, she became the preeminent expert in these cell wall deficient bacteria, these resistant bacteria. So, what I found, I live in the Bay Area, which is a very progressive area. Now, there's good news and bad news for living in a progressive area. Patients come in, they've already detoxed their mercury amalgam fillings properly. A lot of them have done their cavitation surgery with Dr. So-and-so. They're eating a good diet, you know. I mean, that's good, but you as a clinician are kind of going, uh-oh, what do I dig out of my armamentarium? They already did this, did that, and they've got major symptoms, major illnesses. So over time, I became frustrated because as a tonsil focus expert, at least I specialize in that, as well as dental focal infections, I began to see so many of these patients that the main thing they had in common was the fact that as a child for tonsillitis, otitis media, sinusitis, bronchitis, etc., as well as throughout life, but especially as a child, they had many, many antibiotics. So out of frustration, I coined the term CASPERS in 2012. And CASPERS stands for chronic autoimmune, then using Lyda Matman's term, stealth pathogens, resistant bacteria, evolved from resistant bacteria syndrome. And I just needed, patients need a diagnosis sometimes. Well, a lot of times. They need to understand why. And I just found that this was a good way to say, this is what you're suffering from. The immune system is forgotten self from self. The antibiotics have caused this. We took too many when we were children, and our immune system was very weak. So this quizzical expression on this ghost is on purpose because he's not so friendly a ghost. Very common symptoms emanate from this antibiotic damage: pain, anxiety, memory loss, constipation, diarrhea, impotency, etc. Many symptoms that a lot of us and a lot of our patients deal with, but haven't coalesced into a specific disease category and therefore haven't been named for the frustrated patient. So CASPERS is a catch-all term I use for clinical as well as subclinical autoimmune disease and symptoms. And, again, it's good to look at this anthropologically, look at history. The new normal is my headache, my arthritis, my erectile dysfunction, my hypertension, all of these things. It's on TV, it's in popular culture. We've forgotten our roots. This healthy Peruvian boy with all 32 teeth with no cavities. These primitive cultures that Dr. Weston A. Price and his wife went and studied and recorded every summer in the 1930s, they also didn't have any words in many of these traditional cultures for depression and anxiety. Right? They had a healthy gut, they had a healthy mind, they didn't have the neuroses we have now. So again, like I said, this is an overlooked but significant etiology, and I use it as a comprehensive term to describe many illnesses caused by the misuse and overuse of antibiotics. So in the research literature, we can find that it's well documented that antibiotic medications cause immediate, acute autoimmune dysfunction, and they also predispose to future chronic autoimmune disease dysfunction. This is well known nowadays. Oh, okay. So recognize acute disease. This is from Merck's manual, right? Our medical Bible. Lupus from penicillin is very common, as well as myasthenia gravis. Kidney inflammation from methicillin and tetracycline. Interstitial cystitis, well, that's not always acute, right? There are whole IC groups on the web, women suffering for years and years with this chronic inflammation of the bladder. arthritis, rashes from sulfonamides, anemia from penicillin, photosensitivity from penicillin. These are well known. And how many saw this last year, 2013? This is the new CDC manual. Antibiotic-resistant threats. They are sounding the alarm, right? This is a serious threat, this resistant bacteria. To me, I kind of laugh, because if I didn't laugh, I'd cry, right? Because this is the pot calling the kettle black. These are the very allopaths that have propagated the use of antibiotics. And are any of them doing a review of the literature on the well-documented research, peer-reviewed, controlled, double-blind studies on the microcidal effects of echinacea or golden seal or oregano oil? No. What's their answer? At the end of this whole booklet, what's their answer? We're going to produce more antibiotics. And we have so much, we have so many microcidal. I mean, oregano oil, is there any microbe that doesn't kill? That's my antibiotic. I use it rarely, and I use it carefully. The World Health Organization, urgent and catastrophic. It's a catastrophic threat, right? Ebola, etc. This resistance is so serious, so scary, especially for allopaths, because it's their only gun as far as infection. The CDC has classified Clostridium difficile as an urgent hazard. What does C. difficile do in the hospital or anywhere? It literally peels off the lining of the colon, causing severe diarrhea, lethal diarrhea, and death sometimes. Fluoroquinolone, Dr. Lynch was reminding me how in the research it is clearly proven that Cipro readily damages mitochondria. So again, to the list of the many drugs, including nitrous oxide, we have to add antibiotics that cause this methylation, significant damage in the body. There's a Cipro group on the web for the permanent nerve damage. That's the #1 problem. Very severe. Walking wounded or almost walking dead, these people refer to themselves. They're so damaged, their whole system. Tendon ruptures have become so common from these fluoroquinolones. And we know about fluoride, right? It's a potent neurotoxin. That there's a black box label warning, the most stringent that the FDA can use nowadays to warn people. Kidney failure, tinnitus, blindness, cardiovascular symptoms, GI symptoms. And I just want to say here, remember when we're reporting all this, thinking of yourselves, think of your patients when you've taken Cipro or Levaquin or whatever. You may not be here, but what has it done to your kidney filtration system? What has it done to your liver detoxification pathways? What has it done subclinically that along down the road you pay for? Clindamycin causes severe jaundice and almost immediate liver failure in some susceptible patients. Also sets you up for Clostridium difficile infections and possible death. Z-Pak, another very popular antibiotic, right? And these, Dr. Ray and Dr. Stein reported on this recently in the New England Journal of Medicine, where they did a huge study. There were like 350,000 that they studied out of millions of people that had taken Z-Pak, azithromycin, and they found a 2.5%, only 2.5%, but still death rate from fatal heart arrhythmia from this medication. Cancer and antibiotics, well proven. A Finland study, again, a very nice group of 10,000 women. They found significant higher incidence of breast cancer from past antibiotic use. This was backed up by a Seattle study in 2004, very well done, published in JAMA, that confirmed this and found that the chronic use of antibiotics more than doubles women's risk of breast cancer. What happened to our population? What about dentists in April 2007? What happened in April 2007? What changed for dentists? Yeah. After 56 years, what standard of care changed? Antibiotic prophylaxis. It was no longer advised for this population of patients. It's still advised for high-risk patients. So serious congenital conditions, a history of the endocarditis, a problem in heart valves, and also, this is important, the first 2 years following joint replacement. We have a pretty big population of patients with joint replacements now. So remember now, you're only told to prescribe the first 2 years. After that, you do not have to follow that dictum. So 50 years, no research, no prospective randomized placebo-controlled studies have investigated the efficacy of antibiotic prophylaxis in the prevention of infective endocarditis following dental procedures. Dr. Wilson of the American Heart Association, with a group of 23 American Dental Association members, did a retrospective study and found it would only help an extremely small amount of patients if it was 100% effective. So in essence, it was so minimal that Dr. Wilson admitted there's no evidence that it even works, that antibiotics prevent infective carditis taken prophylactically before dental drilling, before dental cleaning. Where's the I'm sorry? Like, excuse me, is Dr. Lynch here? No? Can you imagine if a naturopathic group had espoused one herb that caused all these side effects for 50 years and then admitted, we'd be ridden out on a rail. So, no, I'm sorry, it's just that change. So that's very good for biological dentists to know these parameters now. So, how do antibiotics cause autoimmune disease? In two ways. They damage the gut and they create resistant bacteria. Gut dysbiosis, bowel toxicity. We all know this. Antibiotics deplete the very important good gut, bad gut flora balance in the body, thus allowing the overgrowth of pathogenic gut flora. Leaky gut causes autoimmune disease. When the antigens are absorbed through these tight junctions, they overstimulate the immune system, resulting in autoimmune disease. So, as Dr. Haley said yesterday, what's the other problem besides antibiotics? What's the other toxin that causes intestinal permeability? Mercury. So mercury, as well as antibiotics, cause gaps between these cells of this single lining of our intestine, where normally well-digested, assimilated food products, nutrients should be absorbed into the circulation, into the bloodstream. But as these gaps get wider, partially digested proteins that create inflammation, bacteria slip through, again causes chronic inflammation, and then they go to wherever in our bodies we're miasmically weak, where our issues are. So as Hal Huggins famously described, and I love this picture, we've got to remember that it's not like what we've been described in the commercials and popularly. It's not like John Wayne taking a gun and shooting the bad guy in the chest and he dies, right? It's like the bad guy falls into hundreds of endotoxins, which are then spread out throughout the body. It's not, giving antibiotics is the last thing you want to do. You want to explore all your other possibilities. And then these endotoxins go to places in the body where they like to hide and live. Where do they like to live? Warm, comfortable environments like the kidney tubules, the heart valves, the joint capsules. My hero, Dr. Rosenow, Dr. Edward Rosenow, who was the scientific father of focal infection theory in the early 1900s, said these are partial oxygen environments. That's why they had such a hard time replicating the damage, the disturbed fields from these focal infections in the early 1900s, because they weren't aerobic and they weren't anaerobic, they were partial oxygen environments. And he was brilliant at showing what Dr. Price found too, that if you took a tooth or you took tissue from these areas, they would create the same disease with the same microbial influence in test animals. So the immune function is our gut function. We agree with that. 80 to 90% of our immune system functioning depends on our intestinal health. And this has also been agreed upon in a lot of the research studies, rheumatology research study. There's extensive evidence that altered gut flora microbiota leads to autoimmune disease. Of course, because we don't have our barrier, and that is our immune system. Our immune system protects us from non-self, from harmful pathogens. Now, what else do antibiotics do? They cause resistance. Like we said in the hospital, Staph aureus bacteria was 100% sensitive to penicillin in 1950. But by 1997, it had become 95% resistant to penicillin. So we have PRSA, we have MRSA, we have bursa, and vancomycin now is even becoming resistant to C. difficile, C. diff. Lots of acronyms for what's going on in these hospitals. They're dangerous places to be. A new acronym, CRE, which stands for carbapenem-resistant Enterobacteriaceae. When you have E. coli infections, these newer family of antibiotics often fail to heal the infection. So how do bacteria become resistant? There are various ways. They change their enzymes, they change certain morphology, but the primary strategy to survive, as Lyda Mattman and many others have pointed out, it's their strategy to survive is to lose their cell wall. So here are normal cell wall bacteria. And think of a bacteria, their cell wall is their face. You recognize me because of my face. You recognize a bacteria because of this cell wall on the outside of each of their cells. So normally antibiotics recognize this bacteria through the cell walls, and the primary way they kill them, they're bactericidal, is through that mechanism. So what did the bacteria learn to do? Our generation is every 20 years, right? What's the bacteria's generation? Every 20 minutes. Very smart. We'll never win. The point is not to kill. The point is to find a way to live with harmoniously. So when you have a cell wall defective bacteria, now it still has the thin plasma membrane here holding it together, but it's lost its cell wall. Guess what? The antibiotics don't recognize these bacteria. They can't kill them. But guess what else doesn't recognize these bacteria? Our immune system doesn't recognize these bacteria, these stealth pathogens, as Lyda Mattman said. So then these cell wall deficient resistant bacteria are free to take up resistant in our tissues extracellularly or parasitically intracellularly, both places, in the cell, outside of the cell. And we are then continually poisoned by these bacterial endotoxins 24/7. There's also, and let's not leave out Candida yeast, there's also resistant cell wall deficient fungi. They also learn how to live in our bodies when they're attacked. So here's the other text. We have Lyda Mattman's book, and the third edition is a lot more readable than the other two editions. And then we have Dr. Gerald Dominga, Cell Wall Deficient Bacteria. He specialized in renal disease, but this is a great text on all the different diseases, as well as Dr. Mattman's, that the cell wall defective bacteria cause. Now, Dr. Dominga likes to call them cell wall deficient because sometimes the whole cell wall isn't missing, it's just parts of it. So he calls it deficient versus completely defective. But either way is good. So Dr. Dominga says that these cell wall defective bacteria escape from the immune response of the host, but it requires often very special staining, immunofluorescent staining, to identify spirochetes like Borrelia and other of these cell wall defective forms. He was a Tulane microbiology professor. He's now retired in Switzerland and doing art. Very brilliant man, and still living. And so then we have these, in Lyme's case, which is, again, so epidemic nowadays, we have these cell wall defective bacterial forms and biofilms observed in these chronic Borrelia infections. Now, where do they love to hide out, speaking of biofilms? In focal infections. How many of us here are very familiar with dental focal infections? Yeah. How many of us are familiar with tonsil focal infections? Good. Sinus focal infections? Good. Okay. And others? Good. And that's why we're in the biological dental group, because I have found a lot of holistic dentists not knowing a lot about these focal infections, and that's our history, right? That's our expertise. So we need, as older members, to keep educating the younger ones. So as Dr. Vole said many years ago, 80% of patients' health problems arise in their mouth. And again, these cell wall defective bacteria are very happy in these particular focal infections that are very nice, warm and partial oxygen environments for them to survive and thrive and cause intermittent symptoms. Dental focal infections, again, loaded with cell wall defective strange bacterial forms, biofilm. By the way, Dr. Leeuwenhoek, we think of him as discovering the microscope, but he's called the father of microbiology. He first discovered biofilm through dental plaques, taking a little bit of plaque off a tooth and looking at it under his microscope. So the endodontal and periodontal infections have more than 200 species. The biofilm colonies have 100 billion microorganisms per milligram of dental plaque. We can't fight these guys, and trying to fight them like John Wayne has got us in the boat we are now. Now, we know that when a patient comes in with chronic left hip pain or chronic heart disease, where do we look? We open the mouth, unlike many physicians, unlike many holistic physicians, I'm sad to say. We treat upstream, we treat the cause. We don't treat downstream, the heart disease, right? Because it can be often related to a dental focal infection, a tonsil focal infection, where these bacteria migrate, metastasize, as Walter Clifford says, to those valves where they love to live. It's part of a survival strategy, too. If the bacteria get too big, they'll kill an area, so they spread out just to make us a bit miserable every day rather than killing us. They don't want to kill the host, they just want to survive, so they'll spread out to all the disturbed field areas, right? Kidney, heart, joints, all those classic rheumatoid areas. Don't you wish more cardiologists knew this? And speaking of intermittent symptoms, you know, when we study focal infection theory, it's very confusing, this waxing and waning of the symptoms. Ernesto Adler talked about that. Carol just has that available, right, Carol? That Ernesto, when Ed Arana translated Ernesto Adler's book. You have that for everyone? No? Okay. But anyway, that's what Ed and Carol did for us. So Ernesto Adler talked about the climate in Spain when he'd have tourists come to Spain in the hot climate, that they'd feel great, and then all of a sudden they'd have a tooth flare up or, you know, feel miserable afterwards. Because these bacteria, they get more active or inactive depending on the environment they're in. So, this is an important point. We can induce chronic autoimmune disease without a cell wall. They can cause chronic inflammation and infection in the body. But also, with the cell wall, with certain adverse conditions, these bacteria will revert back and trigger acute inflammation and infection. So the question is, and many holistic dental physicians and holistic physicians and practitioners wonder, does anyone really catch a cold? Right? It's the milieu more so than the bug going around. Is it simply the reversion of these existing cell wall defective bacteria in our cells, in our focal infections, in our fascial compartments, hidden, hanging out, not bothering us every day, that get triggered by hostile environmental factors? So here's my hero, Dr. Edward Rosenau, along with Dr. Weston Price. He observed the transmutation of pathogenic cell wall defective Streptococcus bacteria, and that they appear like what? Viruses. When they change shape and they lose their cell wall, they get smaller and they look like viruses. So the interesting thing in microbiology is this is the little-known counterculture of microbiology. Since I think it's even the 1700s, biologists have been seeing these cell wall defective strange forms. And this is just a small list. I have an ebook outside you can download for $10 from my website on these pleomorphic pioneers that saw these bacteria change forms. There's Dr. Rosenau, there's Dr. Kleinberger Noble, who first called them L forms after the Lister Institute in Europe where she was working. Louis Deans in 1939 coined the term cell wall defective. He was a Harvard bacteriologist. But these were the rebels in the microbiology field, because the conventional microbiologists just said, oh, it's just artifacts or defects. It's not important. And over again, many of these very brilliant and brave microbiologists saw and showed proof of these cell wall defective bacteria. Now, some of you are thinking, well, antibiotics really didn't get popular till the early, mid-20th century. Well, cell wall defective bacteria can also be caused from other things. When you have a severe infection, right? When you get a severe flu, for example, bacteria can revert. There are steroids, birth control pills. There are other causes of these cell wall defective bacteria. Here's Dr. Dominga in Switzerland, the Tulane professor. He wrote fairly recently a very good article in Discovery Medicine about in 2010 about demystifying pleomorphic forms and persistence and expression of disease. It's interesting we're using that word pleomorphism, because some of us recently that became a dirty word, and that's not true in holistic circles, and yet these microbiologists are showing that yes, microbes change form and shape all the time. Atypical pleomorphic bacteria are the organisms operative in persistence and expression of pathology over a wide spectrum of diagnostically troublesome autoimmune human diseases. So how does this relate to me? Well, it's important for your patients, but it's important for us to understand that we're all potentially suffering from Caspers. Okay, these cell wall defective bacteria can cause chronic, intractable physical symptoms besides specific named diseases, joint pain, headaches, frequent urination fatigue, etc. But they're also very commonly causing mental and emotional symptoms. So those are the ones I want to talk about today because they're not so well propagated. So these are more subtle psychological symptoms. They're rarely accurately diagnosed, but they're extremely insidious and quite epidemic. So let's begin with the famous Swiss psychiatrist Carl Jung. So again, I'm comparing psychological and physical issues today and how you can't separate those, right? So individuation. Carl Jung coined this term, which stands for the gradual integration and development of a child into a mature human being. This, in immunology texts and in psychology texts, usually occurs around age 7 or in that area. The immune system matures around that time. This individuation is truncated physically and emotionally when children are given multiple rounds of antibiotics before their immune system matures, and vaccines, etc. So the late, great Dr. Gerard Guignot, a French gemmotherapy expert, was pretty blunt in saying we are creating a race of mutant human beings. Dr. Haley used that word mutant too. And it's harsh, but it's true. But we can climb out of this with the right treatments. So again, this Casper, this not so friendly ghost, can cause a lot of symptoms that are just almost accepted by us, right? Remember that Peruvian boy? The smile and no malocclusion and just happy. You know, do you see that when you walk down the street? Very often nowadays you don't. It's like a ghost-like lacking sense of self, right? We've lost our roots. The drugs have made us slight mutants. We've lost who we are. And all of us are endeavoring very much to return to that place where we know who we are, where we feel that natural contentment. Now again, these bacterial endotoxins commonly come from dental and tonsillofocal infections and move to the brain and spinal cord. Who's heard of Dr. Henry Cotton? Yeah, great, Bill. So he was an amazing researcher around the turn of the century, the renaissance of the focal infection time. He worked in psychiatric hospitals along with Dr. Upson and Dr. Rosenau and cured cases of schizophrenia or epilepsy by pulling teeth or removing tonsils. If you go to Wikipedia, by the way, and you Google Henry Cotton, you'll see that he was just a quack and he didn't do anything. But here's some research from Dr. Cotton's paper on the relation of oral infection to mental diseases, to the Academy of Medicine in New York City. In the Journal of Dental Research, where he's reporting on his success and how these microbes cause all kinds of psychiatric dysfunction. And look at us now. Guess what? We're discovering what we have forgotten or what was discredited. Viruses, and I want you to never look at that word viruses again and take that rote as truth, right? That could be a cell wall defective bacteria, not just a virus. So viruses or bacteria may be at the root of schizophrenia and other disorders. April 2008. We have a new name, new acronym, PANDAS, Pediatric Autoimmune Neuropsychiatric Disorder Associated with Streptococcus. Well, we know at the turn of the century, rheumatoid illnesses were very common. Our parents and grandparents were very familiar with rheumatoid illnesses. We don't talk about rheumatism anymore. How come? Antibiotics, right? They nipped the symptoms so quickly in the bud. Now, they did save some lives, but this streptococcal infection and these syndromes haven't gone away. They've just gotten smarter. So PANDAS is the new term, and a lot of you have heard of this, is for children after tonsillitis or otitis media, sinusitis, etc., that exhibit tics and compulsive behavior and very Tourette's-like syndromes after having a streptococcal infection. Again, it's the bacteria that are causing this. I tend to call it grandas because I see so many grown-up tonsil-focused patients, right? Grown-up chronic neuropsychiatric diseases. And usually what I do is I love to look at the crowd right now and see who's shaking their leg or playing with their ring or any of these compulsive behaviors that we tend to do. It's not you particularly psychologically, it's the bugs. I did this at a Weston A. Price conference, and it was right after lunch, and I'm looking around for people, you know, doing all kinds of tics and nervous things, and the audience was completely quiet, completely serene. We had just had a lunch, you know, with organic bone broths and, you know, fabulous organic vegetables and raw butter, and couldn't find one person in the whole crowd after that. But think of yourself right now. Do you have any, you know, leg shaking, finger tapping, kind of picking at your cuticles, catching yourself, playing with your hair, etc., obsessive thoughts? I shouldn't have said that. What am I going to do next, etc.? Very common, over and over and over, these obsessive thoughts. And all relate to this ego deficiency. Now, I've been doing therapy for decades, and I love it, but I'm saying there are other things we need to look at to help heal that chronic sense of disquiet in our bodies. So, this is a major point. Don't keep blaming yourself. It's the bugs. It's usually the bugs if you've taken care of everything else. So the question is, how do we diagnose Casper's? As I said, it's very expensive, and maybe Dr. Haley and some other researchers can figure out how to diagnose this in the future where it won't be too much money. But right now, we do it through a working diagnosis through the history. I ask all patients about their antibiotic history Again, there's steroids, there's other causes, but primarily they're antibiotic history. And homeopaths and focal infection experts like us have this term never well since, right? We use this all the time when we're taking our history, when we're doing our anamnesis from the Greek, where we're getting a thorough sense of what caused these problems in a patient. You know, you're feeling this way. When did you get that gold crown on top of that mercury filling? You know, when did you get that root canal? You know, when were these mercury amalgam fillings first placed, right? We're looking at this. What caused it? What's the etiology there? And often it's the patient will tell you, I've never been well since I had this bridge placed or since this crown, etc. So, how am I doing on time, Jenna? I've got 40 minutes? Wow. I don't know. I'll have to get out of here. I don't know. We'll just play dangerously. So I'm making great time. You never know. So we'll have time for questions. Okay, treatment for Caspers. First, stop feeding the fire, right? Remove, as Dr. Hahnemann said in the 1800s, the founder of homeopathy, remove the obstacles to cure. He was so angry. Dr. Hahnemann was the one that coined the term allopath. He was so furious at the allopaths because they were using mercury ointments and all kinds of toxic chemicals at the time for all the skin diseases and issues that patients had in the 1700s, 1800s. Of course, as Dr. Ben Joseph said yesterday, what's the most important thing that happened in the 20th century? What's the most helpful health new way of living that happened in the 20th century? Running water, flush toilets, baths every day, hydrotherapy. You know, it wasn't until 1950 that the poorest state in the country, Mississippi, got a majority of flush toilets in their state. In the early 1900s, there weren't that many people with flush toilets. You had an outhouse in the early 1900s because they're mainly agrarian, and then they changed to the city. So we've got to remember these bathrooms that are amazing spas in our houses are brand new. And as Dr. Ben Joseph said, in the mid-20th century, when polio was cured by the vaccine, which wasn't true, at the same time, what was happening was the hygiene went from chamber pots throwing in the street in the 1800s to these amazing running water indoor toilet facilities we each take for granted now in our house. So, remove the obstacles to cure. A toxic diet, and what's the number one food allergy if you have a tonsil focus? Dairy. Dairy. It's very easy. It's very trendy now to give up grains and gluten, and it's important for some. But of course, if you prepare the grains properly, soak them, and pour off the phytotoxins, not so many of us are as gluten sensitive as we think. But the dairy's a lot harder because that's mother and rich and creamy and delicious food. So anybody with any chronic health complaints, I'd ask you to do the elimination challenge test. Just avoid dairy for 2 weeks and see how your symptoms change. And if they do, consider yourself a primary dairy allergenic person, and in the future you'll be able to go back to dairy, but do it V and R. What's V and R? Variety and rotation. Don't let that immune system get used to the same cheese every day, the same yogurt every day, the same cream in coffee, cream in your coffee every day, right? Then it gets stimulated. I got a great email from a patient who said, "Why are you saying that? You know, Weston A. Price visited the Scottish Gaelic civilizations, and they ate oats every day, right? They ate oats every day." Well, the problem is that nowadays we're all fitting into more pathogenic miasms, like the tuberculinic miasm, which is the hallmark of being allergenic. So we're just not the stuff of our ancestors. Ask some of your patients in their 80s and 90s, what did school children call one of their classmates who wore glasses in the early 1900s? Four eyes. Why? Very nice, right? Why? Because it was so rare. Look at the children now. You see a lot of glasses at very young age, right? You see a lot of malocclusions, more malocclusions than not. Okay, so easy on the petrochemicals and the soaps and cosmetics, my best bets list. Just go to my website. There's lots of good clean makeup and soaps and shaving cream. Watch the isolated vitamin supplements. These come from pharmaceutical companies. So I tend to, they're isolated fractionated ascorbic acid or thiamine, et cetera, and then they're wrapped up in, maybe some good other ingredients and sold by holistic vitamin companies. But if your testing gets cleaner and clearer, you'll find that really food should be your medicine more than a lot of these supplements, except for good products like the Ketone and Dr. Shade's glutathione and arlipoic. There's a lot of good products out there, but they're more natural. Excessive EMF radiation, cell phones. I keep mine on airplane mode most of the time. And mercury amalgam fillings, of course. Here's an ebook on my Radical Medicine site. I call it an ebook, but you can just download it, $10. If you don't do a whole protocol for your patients, this is called the 5 Dental Detox Days, and it's a protocol for detoxing from amalgam filling removal. And I'll go into this more in a minute, but what I found is if you hit fire with fire, if you hit that acute infection, that acute insult right after you remove the fillings for 5 days, and then go to a more long-term treatment plan, you mitigate so much damage from that mercury amalgam removal. Second, stop taking drugs. Stop feeding the fire. If your allopath or osteopath or naturopath or dentist deems it very necessary, be sure you surround the dragon, as they say in Chinese medicine, right? Make sure you're taking glutathione and arlipoic and taking good drainage and herbs to mitigate those antibiotics and to get those toxins out of there as soon as possible. Again, we know the WHO and CDC, et cetera, are saying try to avoid as much as possible these drugs. Third, clear focal infections. We know that, right? Dental, tonsil, sinus, genital, et cetera. So the dental focal infections we do through cavitation surgery. And a lot of you know that a lot of you use ozone. A lot of you use silver solutions, which kill everything. I like this Guardian Silver Sol company. It tests well for me. So microcidal, it kills every bug you can imagine. Parasites, protozoa, bacteria, virus, fungus, etc. The notatum or the notochel is a great natural antibiotic. Arnica is such a fantastic anti-inflammatory and restores blood circulation so fast that really good arnica, and this is controversial, but I like patients to take it right before drilling. Some people say not to. I disagree. Take a dose right before drilling, cavitation surgery or mercury amalgam removal, and then afterwards about twice a day for 3 days, along with hypericum, just to make sure there's no nerve damage. And of course, our clean, sterile offices nowadays are amazing, right? It's the same thing with regular surgery. Just prophylactically, they give antibiotics for any surgery they do, and it's just covering their ass. But we've got beautiful, operatories now, and very clean and sterile. And thanks to Joanne and Bill Galeros, thank you so much for this beautiful picture of obvious radiolucencies at the tip of these root canal roots. This is, again, the 5 post-cavitation surgery days. Again, hit fire with fire, make hay while the sun shines, whatever. Go ahead and detox and support that surgery directly afterwards, and then long-term at a lower dosage. So this is also available if you don't do that yourself. Fourth, the most curative treatment in the world, constitutional homeopathy. Many of you know that I had to go all the way back to school again after being a holistic chiropractor, moving to Washington State, which wasn't very friendly towards chiropractors at the time, to become a naturopath just to do homeopathy. And then I quit after going back to school again because the old style didn't work for me. It just drove me crazy. Constitutional homeopathy is one remedy, one plant, animal, or mineral remedy, whichever one you are, for your whole life. Isn't that amazing? So you're either aluminum, or you're poison ivy, or you're, horse, or whatever, any kind of, any remedy. And it's so counterintuitive. Please don't try to ever do your own constitutional homeopathy remedy. It's so difficult. It's the hardest thing I've ever studied, but it's fantastic. So Dr. Rajan Sankaran in Mumbai, India, the most famous homeopath in the world, and Dr. Divya Chabra, his wife, are the two leading experts on this new style of homeopathy. If you get his book, it's called The Other Song by Sankaran, and it helps explain what we're trying to do. And he's basically saying that, the song of a tiger is a beautiful song, right? A tiger is a beautiful animal, but it becomes very discordant when it becomes entrapped, that energy in our bodies, with our song. So we need to take that other song and slowly dissolve it. This is all really far out, isn't it? I mean, this is pretty amazing that these energies come into us, this life, past life, I don't know when, and they somehow are there adaptive. I mean, the other question is why they're there, but it's fascinating. But for me, this is my foundation. If I have a patient come in and they're severely damaged from antibiotics or mercury amalgams or whatever, and they can't even take a supplement. I don't even want to do that because why? Their immune system is so reactive. They react to vitamin C. They react to almost everything. I often begin with this as the foundation. I may take a year before I start getting those amalgam fillings out in those particular damaged patients, right? Anyway, Divya Chabra is my person now. I don't know how these two are still married because they both do the same method, but she's really different, and I think she's the best homeopath in the world. So I go see her on the East Coast every year, twice a year. And please, any of you who want to do this, you'll suffer for 3 years or so, but you will end up being a homeopath that does miracles with this particular method. So please come to Boston and New York and talk to me about that twice a year and learn this method. We don't have many people really doing Divya's method, and she's got it. This is what I was talking about before. We're all got one foot in the tuberculinic level, this chronic susceptibility, some feet in the luetic degenerative condition. What we want to do is move this way. And the homeopathic remedy changes our DNA pattern, changes our genetic blueprint, because it removes this huge distortion pattern that's been sitting on us for all these years. It clears the miasmic pattern, slowly but surely, within about a year and a half. Oh, and here's an important thing. We have so many very injured patients. In the early 1900s, the holistic chiropractors and osteopaths would just adjust the woman with menstrual cramps, and they'd go home and they didn't have menstrual cramps anymore, right? Or you'd take the kid with chronic ear infections, you'd just do cranial on the cranial bones, or adjust a cervical vertebrae, and the otitis media would get better, right? Do you find that anymore? No, people are really hard. We're all in this autoimmune situation. So here's what I love about the homeopathic remedy. The body we are conditioned to survive. The body will survive at any cost, right? It's not going to bring up these cell wall defective pathogenic bacteria and fungi easily. We have got to change. We got to turn around this boat. And it's a big cruise ship. It's not easy. But after you've been on the homeopathic remedy for a while, the body will be able to get rid of these carcinogenic microbes, these very toxic pathogenic microbes within the cells, within the fascial compartments, within the focal infection areas. One of the best ways to heal focal infections is cavitation surgery as well as getting your remedy. Yeah, and I just said that. We can mobilize and clear these bacteria, and we can't kill these bugs. We just create more resistant bacteria. Now, if we treat them strongly. So let me just make a point on acute illness versus chronic illness. So as I said, the 5 dental days, etc., or you get the flu, you come down suddenly with the flu, right? Or you get horrible infection, bronchitis, sinusitis, whatever. Acute illness, what do? You run to the health food store, you take your homeopathic remedies, you take your supplements, you take your essential oils, you take all the things you take oscillococcinum for the flu, etc. You take all these products with gusto, high dosages, because you meet fire with fire. You meet strong dosages, strong prescriptions with the very strong illness. It's appropriate. But don't do that chronically. Not with these smoldering focal infections. Don't give patients oregano oil every day. Don't give them antibiotics every day. You just make these areas angrier and you create more hidden resistant bacteria. And I'm not going to make a lot of friends right now saying this, but I've got to say this. Watch the ozone. Watch the amount of ozone. It's completely appropriate after surgery to do, or after any dental procedure, to inject ozone in good amounts. But if you have a chronic smoldering tooth that is on the border of being a dead tooth, don't inject it with a big bolus of ozone. I've had patients lose teeth just from the whole reaction that the body gets from that, right? So again, it's okay, acute illness, hit it hard, chronic illness, just a little bit of ozone, just a little bit here and there. You're helping to remind the immune system what's normal, what's healthy, what's normal homeostasis, stasis and regulation, and then allow the immune system to pick up the ball. So just watch the amounts of ozone on chronic bacterial dental focal infections. Okay, 5th, plant polysaccharides. So you can't kill the bugs anyway. We need to modulate and regulate the immune system. Let's do a review of food, right? We've got 3 core nutrients, right? Fats, proteins, and carbohydrates. We have essential fats, fish, etc. We have omega-3 and omega-6. Essential meaning we must get these in our diet. We need these essential fatty acids. We have essential amino acids, right? Essential proteins. There are 10 amino acids that we must get in our diet to survive and thrive. But what about poor carbohydrates, right? They've been kind of left out. Well, again, as Dr. Ben Joseph mentioned yesterday, there may be essential carbohydrates as well. This is a big text on glycobiology, and carbohydrates just the last 20 years have been getting a lot of attention. So there are 4 types of carbs. There's the monosaccharides, glucose, fructose, going all the way to the polysaccharides, long chains of sugars. And these essential monosaccharides like glucose, etc., there are more than 200 of these. But researchers the last few decades have been saying 8 of these we really may need in our diet. And here are the 8 essential monosaccharides: glucose, galactose, mannose. We want to pay attention to mannose. So mannose is such an important sugar that there are special pumps on the intestinal wall to specifically extract mannose from food and move it into the circulation just for this particular sugar. And again, Dr. Ben Joseph mentioned yesterday that mannose has been referred to, or these 8 essential sugars, in general have been referred to as the part of the plasma or the matrix. They've been called the code of life because mannose, there are other pumps to move it out from the circulation, and then they help build glycolipids and glycoproteins, very essential in cellular communication. There we have the very important glycoproteins in the cell wall communicating from the intercellular to the extracellular space. So what do we know about autoimmune disease? We have a lack of cellular communication. Without adequate amounts of these essential carbohydrates, the immune system can't recognize self from non-self. So this allows these foreign antigens to be absorbed and implanted in tissues and resulting autoimmune disease. We've already said that. Now, how much mannose in our foods? Surprisingly, not much. I don't think God planned on antibiotics and mercury amalgam fillings originally because we don't have many foods here to heal ourselves with food, like Hippocrates said, right? There's some in green beans, tomatoes, cranberries, we know with urinary tract infections, but not enough. And here's these 8 vital biological sugars that research is now saying are important for us to ingest in our diet, which goes against the paleo diet long term. These people can get well with that, but they do need good sugars at some point. So, asamanin is a plant polysaccharide in aloe, in abundant amounts in aloe. And it's in the inner leaf gel, and it breaks down to our messenger monosaccharide, the very important monosaccharide in our bodies, mannose. So research studies, especially Bill McAnally, he's the expert on aloe, have shown that asamanin and the mannose it breaks down to is curative for autoimmune disease. So Carol Arana back there is the one who first turned me on to this. She had a few meetings back, a few years ago, she had Digestacure. Maybe y'all have heard of that. It's an aloe product, and it helped. It was pretty good, and I tested it, and I'm really picky with my testing, and it tested well. Then there's another product called Serovira, and if you go to the websites of these two products, you will see patients with irritable bowel disease, ulcerative colitis, Crohn's disease, getting well. I mean, cured. Pretty amazing testimonials from this aloe powder. So I developed my own a year ago because I found that the other two were actually too strong, and I named it Champ Pro because it stands for chained aloe mucopolysaccharides, plus I added probiotics to it. Now, unfortunately, when I said I was going to lecture on this topic a long time ago, I didn't know that the chemist who's working on this new rendition of this product for me, that his wife would get cancer. So I have one Champ Pro outside, but I'm almost out of them. And we're developing a new Champ Pro that's very new and improved that you hold in your mouth a period of time before swallowing. And it's a way of preserving the RNA nucleotides in the acidophilus to wake up, not stimulate, wake up the innate immune system in the mucosa of our cheek, in our cells of the tissue. And I'm very excited. This is a brand new type of acidophilus. I don't really like a lot of acidophilus because I feel like it's more in the repair and regeneration stage because as if you study SIBO and other researchers, you'll find that they agree with me. It often inflames and activates. I mean, when you don't have a good soil, you don't go in and try to plant new healthy bacteria, right? You just create a war with the old toxic bacteria. So anyway, I do have a sample of this outside at my table, but if you come by and give me your email, I'll let you know in January when I have this new, very exciting product, which is aloe that heals the gut, and this new type of acidophilus that's being, hopefully will be available the first of the year. So, to me, and probably to many of you, these are the 4 20th century toxic insults. Which was the worst? Who knows? Who knows? But I find the antibiotics are very overlooked, and I wanted to bring them out today. I'm using the word Caspers for the patients that need to have a diagnosis, to need to understand why they have these chronic symptoms and feel so terrible still, even though they've done everything else. So again, remove the obstacles to cure, have a healthy lifestyle, stop taking drugs if at all possible, clear the focal infections, constitutional homeopathy according to the sensation method, take Champ Pro, especially the new rendition. And I have the ebook. You can just download it, $10. It's 100 pages or so. So I didn't print it out, but I have a sample out on the table. Okay, brand new subject. Since I wasn't able to bring Champ Pro and all this on the subject, let's go to what I did bring out on my table that Dawn offered me this time. How many are planning on an unexpected death? Put your hand down. Nobody's supposed to raise their hand. You ruined it, Bill. Okay, but the second question is, are you prepared for an unexpected death holistically? Is your spouse, or if you're single like me, is your health care agent apprised of what to do if you get hit in the head and you have a head injury and a concussion, if you have a stroke? And, of course, in our society, in our group, we certainly know about stroke. Dr. Ed Arana, Dr. Andy Landerman, my malocclusion guy, Gary Bruner, just had a stroke. He was my favorite malocclusion guy. He did a great job fashioning appliances for me. Didn't tell me until 2 weeks later. It's too late. So what do we know about acute disease? Hit fire with fire. So what do you do if somebody has a stroke or heart attack or whatever, or your loved one does? You call 911, and then what do? You pray. Good. And what do you do third? Well, yeah, you immediately go to, I have these little gray kits, and I worked very hard on figuring out what are the 8 most important, or the 6 most important homeopathic remedies. 2 of them are in higher potency that you need for these acute emergencies. And you immediately start dosing. Mainly it's arnica for heart disease, stroke, concussions, head blows to the head, etc. But I also have opium in there when someone's in a coma that's very sleepy and stuporous. I have hypericum in there. I put hypericum in there in 1M. And I sure hope that the next football player or little boy or little girl on the soccer team that gets injured and can't move immediately starts getting hypericum. Just open up their vestibule, put it in there if they're unconscious, put it in under the lip, or let them take it orally every 15 minutes. So we don't know how much these homeopathics can help. But in India, where homeopathic physicians normally reside in hospitals, they see miracle Lazarus-like cures from comas and strokes, etc., with aconite and arnica and all these homeopathic remedies. So acute homeopathy is not hard, and it's fantastic. So I brought these little gray little packets of homeopathic emergency kits for you to keep in your office or your home if you don't have them, to immediately start giving, with a little brief packet of instructions plus a little ebook that I just put together for you to use in emergencies. And the second reason for this is that DNR, do not resuscitate. Again, this is to protect yourself against the allopaths and the hospital, because those of you that have gone to the hospitals know what happens. They're in charge, and you don't get to do much of anything, right? But if you designate a health care agent in an advance directive, which is better than DNR, in an advance directive, and I have a form in here, you say, here's what to do, and here's what I'm going to do. My girlfriend, who's a naturopath in Seattle, she's immediately alerted. She calls my 2 homeopaths, one in America, one in India. We decide whether to do arnica or aconite or whatever, or my constitutional remedy. Here's where my constitutional remedy is. It's in my cabinet, etc. Here's the things that I want. Here's the things I want you to do if I'm in a coma. And, don't pull the plug so quickly until you've tried homeopathy, Don't pull the plug so quickly. So if there's no hope, yes, but first let's try our holistic, amazing medicines that aren't often used in hospitals. All right. I can't believe I finished on time. Okay, great. So we have about 10 minutes for questions. Yeah, Mike?
Sure.
Great presentation. Thank you. As always.
Thank you. Thank you.
When we come to many of these meetings, I take fish oils from a very good source, and I go up to a product called Yes. It's plant-based omega-3s and 6s or 9s or whatever.
Yes?
And they sit there and tell you that you shouldn't be taking fish oils, they should only be doing plants. What is your opinion?
I think fish oils are fabulous. It's hard to find a good source. For me, consistently, Green Pasture, Dave Wetzel, his fermented fish oil, skate liver oil and cod liver oil, continue to test the best for me. The history with cod liver oil is that our parents and our ancestors and some of us took cod liver in the 1800s, 1700s, 1800s, early 1900s, and had great success with that natural occurring vitamin A and D in the correct ratio, right? But then what happened is, in the 20th century, quick way, let's produce things quickly and as easily as we can, the old style of producing cod liver oil got lost. So Dave Wetzel, a Nebraska farmer, went up to Norway and Iceland to try to figure out what the fishermen used to do. And he found out that the fishermen would come home, they'd take the fish livers, they'd throw them in a barrel, they'd let them ferment and go through all kind of metabolic processes. Then they'd pour off the oil, strain it, and that's what cod liver oil is. And so Dave Wetzel is now making that now, cod liver oil, and also skate liver oil. Cod liver is a bony fish, right? It's good for bones and teeth. It's better for osteoporosis in older people, and it's better for children and dental issues and teeth and bones. Skate liver oil, skate is like a manta ray. It's a cartilaginous fish, so it's better for tendons, ligaments, etc. I find skate liver a lot more for adults, cod liver more for children and senior citizens, which I'm in that category, but I like skate liver better.
I just want to add a comment here to what you're covering here, Louisa. You brought up the topic of end of life and things to do in the hospital.
Yeah.
I spent 5 years on a code blue team in a major hospital in LA. My job was to draw arterial blood from the femoral artery while we were resuscitating patients. And I probably participated in about 80 or 90 events over my 5-year term, before, during, and after dental school. One of the things I would say I saw routinely in terms of comatose patients and spinal cord patients, because we had the we took all the spinal cord patients in LA County, there's absolutely no attention paid to oral hygiene. While these patients are trached or they're on a ventilator, and I had no awareness of this, but I want to link this to something that's happened most recently, but virtually little hygiene goes on. So I can't imagine what's growing in these patients while they're sitting there comatose, fighting for their lives, trying to come out of this situation. And what's happening in the respiratory end is they're keeping people alive really on ventilators and trying to wean them off of oxygen through various therapies, and that's what goes on most of the time. But most recently, I've had a patient come into my office, and maybe all of us have had experiences like this, but in this situation, this gentleman was in hospice 3 months ago, and he came to see me on a walker, couldn't stay awake, 2.5 liters of oxygen, And I'm certain that very few people would have treated him. I couldn't have gotten anybody in town to do it. So I started doing surgeries because all of his teeth were rotten and under the gum. And we've had 6 surgeries, and he is now, I watched his color, everything just restore. Wow. He's walking with a cane, no oxygen, and we've seen this happen. Honestly, I think we need to have dentists in the ICU to start screening for oral infections.
And reduce that load.
Yeah, decay is nothing more than an open wound that has not been treated. Mm-hmm. And that's what I'm coming to see. We've got to begin to link these medical conditions with dental stuff and bridge those, because even the nomenclature we have is wrong.
But that's what started in the early 1900s. Yeah. Dental physicians were in tune with medical physicians. Dental physicians are physicians. And then with the whole rise and fall of focal infection theory, the allopaths got really angry at the dentists doing all these things below the head, right? And then that became that chasm where now dentists are over here and medical doctors are over here. And it's just horrible, absolutely horrible. I agree.
A suggestion that we use in our practice is everybody, first of all, you get a high-grade toothpaste. We don't use fluoride or glycerin in the toothpaste. After they brush their teeth, we have them use a high-grade essential oil, either lemon, lime, grapefruit, orange, wintergreen, peppermint, and they take 5, 7, 10 drops and brush their teeth afterwards with the essential oil and swallow it, eat that. And it will clear all the plaque. You'll go, if you do that every day, within the next time you go to the dentist will be pissed because they'll go, who cleaned your teeth? And they won't believe that you're not cleaning your teeth.
But Dr. Ben-Joseph, be careful, because with your autoimmune disease patients, those fabulously microcidal essential oils are also killing some bacteria and making other bacteria smarter. So the chronic use, I think intermittently it's fabulous, but just be careful with your more sensitive autoimmune type patients.
Yeah, I've never had an issue. So.
Yeah, okay. Yeah. Yeah, essential oils are our antibiotics, right? Our natural antibiotics.
Louisa?
There's no stairs. What do I get?
Thank you for speaking. It was wonderful
speech.
Sweet.
Look at you. Oh, that's so sweet. Thank you.
The body's broken out at the bottom.
Okay, isn't that beautiful? I'll keep this on my desk forever. Thank you, sweet.
Be careful, the bottom's broken.
Oh, okay. Very gentle. Thanks so much.
Okay, your